Welcome to Nursing 133, Chapter 9, Basic Intravenous Calculations. IVs are necessary to hydrate or administer medications rapidly, or over long periods of time, for that matter. The two ways an IV can be run are via volumetric or infusion pump, where the answer is always in mLs per hour, or by gravity, where the answer is in drops per minute. Remember, drops are represented small g, small tt, g, t, t. Another consideration in IV flow rates is the tubing drop factor. Tubing is not a standard size and varies by manufacturer. The different types of drop factors that are available are 10 drops per milliliter. That is a macro drip. 15 drops per milliliter, 20 drops per milliliter, up to 60 drops per milliliter, which is known as a micro drip. Now, equipment that you use, you'll be using IV catheters. This is an IV catheter. You can see that the IV catheter has a white plastic tip. This is a straw-like structure that actually goes into your vein, that's introduced into your vein with a needle. This is over the needle. You slide it over the needle into the vein. Then you extract the needle and leave the catheter in place. The blue tubing that you see, or the blue hub, is what you'll see on the surface of the skin. This can either be capped, which is known as a heplock, or connected to IV tubing for your IV line. You have two types of IV lines. You have what's known as primary tubing. This is what's depicted here, and secondary tubing, which will be in the next slide. Your primary tubing consists of your IV spike that spikes the IV bag. You take off the cap, this remains sterile, and you spike the IV bag, introducing the IV fluid into what's known as the drip chamber. This chamber here is the drip chamber. This is where the drop will form and fall into the chamber. You then have a check valve. This is for air to prevent. And then you have your various ports down the tubing. Your first port is for medications. Medications such as secondary IV tubing can be connected to this port. You never give IV push medications through the proximal port. It's called the proximal port because it's closest to the IV bag. You will then have the roller clamp that you can adjust drip rate with, a slide clamp that you can shut off the IV tubing completely with, and then of course the distal port, because it's the farthest away from the IV bag. This is the port that you always use, the port that is closest to the patient to give IV push medications. The IV tubing then extends and is connected to the IV hub, and that is how you connect an IV. Secondary tubing is similar to primary tubing in that it still has the spike that you spike the medication bag with. It'll have a drip chamber. Depending on the type medication, this might be a macro drip or a micro drip. If you notice, you do not have any of the injection ports along the tubing. All you have is the roller clamp to adjust the rate. And then it connects directly, this would connect directly to the proximal port on the primary IV tubing. In addition, you'll notice what's called the extender. The extender comes in the secondary tubing kit, and that is used to drop or lower the primary IV fluid so that the secondary IV fluid is hanging higher. The secondary fluid must always hang higher than that of the primary fluid. Now let's practice. The doctor orders 250 mLs to be given over 4 hours. The tubing has a drip factor of 20 drips per ml. How many drops per minute would you administer? Well, let's start with what we know. What is it we know? We know the order. We know that 250 mLs is to be given. And we also know that it's to be given over 4 hours. So step 1, we know that we have 250 mLs to be given. We know that this is to be 250 mLs is to be given over 4 hours. So you see the 250 is over the 4. We then want to start implementing our conversion factors. Well, first thing we have to implement is a conversion factor of time. We know that if we have a symbol, we need another symbol to cancel that symbol out. So we have a symbol of hours here. We know that 1 hour equals 60 minutes. 60 minutes is in the end of our equation, so we definitely want to keep that. And we know that the other conversion factor from the story was 20 drips. The 20 drips per 1 ml. Since we have mLs up here, we need mLs down here to cancel it out. We know that drips is in the end, so that won't be canceled out. So what we'll do is we will cancel out the mLs to mLs, and we'll cancel out the hour to hour, leaving us with nothing but the drip factor and the minutes, which are the answers that we're looking for at the end of our equation. Then we simply do the math. Once we calculate, we come out with 21 drips per minute. And that is how you calculate an IV drip rate. This concludes Chapter 9. Ensure you do your review, your homework, and your quiz. If you have any questions, feel free to contact me or Miss O'Connor during our office hours, or you can send us an email at your leisure. Have a good day. Bye.